You might get it someday. And we've been wishing for a national health care program since at least for 100 years. Luckily, we got it, and it's going into effect on January the 1st of this year. You can actually start signing up for it in October. Now, just for some fun, before I started over here the other day, I downloaded the paperwork you got to fill out to get it.
Yeah.
And it's only 60 pages long. And you almost have to have a master's degree in something. But anyway, now we have heard rumors that it's been reduced to like 8 pages. Of course, you can't get that 8-page one yet, but hopefully it's coming. We're not going to go over this today because we're going to be a little more general than specific. If anyone would like to look at this and have nothing to do tonight, instead of going to the casinos that are down Bourbon Street, feel free to ask them later. There won't be a long time. So anyway, folks, myself and Maria here have been kind of looking into this because we thought it might be interesting on one level, at least inform our members about what might be starting to happen to them. And now some of us members might almost be qualified, like Wade and me, to be in Medicare, which, you know, sometime soon. But even if we are, we might want to like my dear son about it, because he's 23 and he might need to know this information. And obviously family members might be a little bit younger, they might want to know about it. Now there's kind of two groups, people that have insurance and people that don't. Okay? Well, generally speaking, the people that have it, it's pretty much going to stay the same, except, of course, there have been some changes that happened in 2004, like if your son, like my son, is less than 26, he can still be on our policy. It didn't used to be that way. Right now, you don't have any limits. If you get really, really sick, and it used to be you spend $100,000 or something, and then it would go away. But now it stays there forever if you get sick, and the insurance is going to cover you. There's a bunch of other good things that are going on for the people who already have health insurance. But there are some 40 million people that don't, and it is whenever you pass anything like this in Congress, there's even in Medicare, when they passed it, they came back and made changes as it went into effect because, you know, they didn't get it exactly right. Well, they didn't get this law exactly right, but they're trying. One of the things they didn't exactly do right was get enough money to implement it, and which is they're going to have these navigator-type people that go out and help people apply for it. And Congress didn't give enough money, and even the Secretary of Health and Human Services was trying to go raise money from the outside people to help navigate people through this system. And then she got criticized for raising private money. But so Maria's going to go over the basics, and then we're going to have a question and answer period. And now I'll try to answer things. And what I can't answer, Maria will answer, and then what the other of us can't answer, then Wade will take a crack at it. He didn't know he was part of that program. Now, what will probably happen is that we're going to cover this, and it's going to raise more questions than than the answers we give you initially. But it's a process, and you need to go back to we went out in HISD and had some meetings, 5, 10 people in a room. And it's incredible the knowledge that no one knows anything about this program. Not anybody. And they had hundreds of questions. We wrote a bunch of them down, right, Brenda? But, and we didn't know the answers to some of them, but we went and looked them up. So it's an ongoing process. They have funding, partial funding to fund this for a 5-year period. So they realized that it's going to take a while to get everyone on the program like it ought to. Marie?
Okay, my name is Marie. I work for A Community Voice, and I'm also the director for Southern United Neighborhoods, which is our nonprofit. And as you heard from our report, we're doing a lot of stuff in Louisiana, but we want to expand some of the services that we do in Louisiana to partner with the local 100 offices in Arkansas and Texas. So we hope to be able to facilitate, helping people get the information about healthcare and what's going on. So we could just go over, people call it Obamacare, but it's really the Affordable Care Act. And I gave everyone a copy, I think, of some of the main points, and we could just go over them briefly. But it's supposed to be designed to make sure everyone has health care. So the insurance companies will no longer be allowed to discriminate against people if they have pre-existing conditions. I don't know if anyone's ever been turned down because they've been told they had a pre-existing condition. But that's basically if you have an illness or something wrong with you, the insurance company sometimes will say, oh no, I'm not covering you. So, and then you're supposed to be able to go to any doctors you want to now, you know. Whether that works in theory or not, we'll have to see. And as Oral said, if you have kids that are 26 and younger, they can still be on your health insurance, which helps a lot of college students, because I know a lot of college students, they go to college and they don't have health insurance anymore. So, also, it ends the lifetime limits on coverage. I don't know if anybody's experienced that here, but if you get cancer or some serious illness, sometimes they'll be like, well, you exhausted all the money and you've reached your limit and you've maxed out and we're not going to pay for anything anymore, which happens to a lot of people when they get really sick. And also the pre-existing conditions is going to include covering children with pre-existing conditions. So if you have somebody, child that's born with a birth defect or something wrong, they still have to cover that. Now insurance companies aren't going to be allowed to just increase your premium every year just willy-nilly. If they go over 10%, they have to justify to the government why it went up so much. Because I know we all experience that, right? Because the older you get, the more your insurance costs. And that's really not fair because you've been paying out this whole time. And then another thing is when you get the huge bills from your hospital, sometimes it won't even cover your health care. They'll just cover your administrative costs to do your paperwork at the hospital. So this law makes it so the premium that you're paying for your health insurance has to go to cover your health care. It can't go to pay somebody to do paperwork. So it's supposed to cut down the cost. There's going to be no, let's see, emergency. Oh, okay. Basically, you're supposed to be able to go to any emergency room. You're not going to have barriers where they say, oh no, your insurance company is telling you you can't go to this room without it. Another thing, additional laws for like preventive care is supposed to be no cost, so no co-payment for that. You know, a lot of times you go to the doctor and you have to pay co-payment. So if it's preventive care, that's supposed to be covered under your insurance. And you have more rights to appeal if somebody denies paying a certain bill. If your insurance company denies pay this doctor or this hospital, you have more rights to appeal. Basically, what it means for everyone, regardless of if you have insurance or not, is that it's supposed to end unfair insurance practices. So there'll be less, I guess, divisions between the different companies and what they do and what they don't do. It ends the lifetime, we already talked about, limits on coverage, covers preventive care, and helps contain premium costs. So all that's going to apply to everyone, even if they already have insurance. Now, for those that are uninsured, you'll be able to buy insurance through what's called an exchange. And basically, they're streamlining the application process for health insurance. So that 61 pages, which hopefully will be only 8, is the application that everyone will fill out, regardless of if they're buying private insurance or they want to get on Medicaid. So you would fill that application out what's called an exchange. Now, Arkansas is a little unique because they have a state and federal partnership, so they're going to have something that looks like a state exchange. Louisiana and Texas rejected that. So it'll be up to people to deal with their federal exchange in states that rejected Obama. So,
Where did they exchange from?
I think, and theoretically, for the federal exchange, it might be on the computer. Because they wanted states to create their own exchange so that they could have somebody, you know, locally handling that. I think it's still up in the air how they're going to work out the federal exchange because our local state offices aren't going to get any of the money to handle that. So that's why they have these navigator grants come out to give money to nonprofits and stuff to try to do some of this. But you still have to have an expert. Even if we did the outreach for it, we're not legally allowed to sign you up. You have to go to somebody that's certified for that. So it's unclear how that's going to work when you have no state exchange. That's why they say for states, which is on here, for states that reject Obamacare, it's going to be less people signing up because it's going to be more barriers to signing up. So, but it creates a standard benefits for each insurance policy. So they have to include things. The basics would be medical, mental health, prescriptions, and rehabilitation. You know how some insurances are like, we're not going to cover mental health or whatever, that's not going to be allowed anymore. And basically, you can get tax credits if you purchase your insurance. So anybody, if you're like, if you earn less than like $59,000 as a couple and $44,000 as an individual, for paying your private insurance, you're going to get a tax credit for that. So I know you heard that some people are going to have to pay penalties if they can afford insurance and they don't sign up for it. But the alternative is you're going to get a tax credit if you do it. And then, as you know about the Medicaid expansion, they're going to expand Medicaid starting in 2014. And so that'll be for everyone, children, parents, adults that don't have any children, because right now the Medicaid only covers certain classes of people, right? Children, pregnant women, people with young children, disabled. Now it'll be everybody that qualifies based on income. And that's going to be around, it varies from state to state, but all our states are pretty low income states. It'll be around $15,000 a year in income, or if you're a single person, and $21,000 for a couple. So that expands it way up because it's going, you know, right now it's just very low what the requirements are. And so folks on Medicare, the changes for them will be that it's going to cover their wellness care and preventative care. And they're going to have lower out-of-pocket costs on their medication. And also more, they say protections around nursing home care, and really that's kind of vague because I don't know what procedures they're going to put in place for that. But they say they're trying to protect the spouses of people on Medicaid, so it's not like you have to pay all the extra bills or all the money. There's going to be protection, financial protection around that. And they want to, states that decide to participate are going to get incentives to do home health care because they're trying to promote independent living as opposed to nursing home living. So it's unfortunate that our states are not going to participate because that would be a benefit to many people that do home health care. In the workplace, I know you've heard about, employers having to provide health care and a lot of people being required to work only part-time now because they don't want to participate in that. Well, the law says that if you're a large business, which they consider over 200 or more employees that work full-time, then you must provide a health plan. And you must tell your employers of the coverage options. And employers over 50 that do not provide insurance have to pay a penalty. Now, the penalty is very low. It's less than it costs to pay for insurance. So there's that's nothing. They might as well not put that in there because that's. And your first 30 employees are exempt from the penalty, right? So you have 50 people that you're saying I'm not going to insure. You have to pay a penalty on only 20 of them because the first 30 don't have it. So that's really weak. And they're leaving it up to states again for small businesses because there's a lot because those not required, a really small business, they're trying to encourage them to offer insurance. by saying you get a big tax break, you get these special deals, lower rates, and the states can set up an exchange just for small businesses. And nonprofits get tax breaks too, supposedly, so we'll see how that goes. Now, all the laws are going to officially start 2014. They're going to release the application in October of this year so people can start signing up. Let's see, I talked about Medicaid. Oh yeah, with the Medicaid expansion, the same citizenship rules apply, so they're still not willing to cover undocumented workers. And then you can't be incarcerated, so they're not paying for that either. And then if you're 65 and over, of course you do Medicare, not Medicaid. Now, one thing that I read was about the 12-month certification on your income. It seemed to me that that means you have to recertify each year, which I don't know how that's going to work because the application is very long. And I know with food stamps you have to income certification each year. So that might be a lot more paperwork for people that are helping people try to sign up. Now, I think a lot of people in Louisiana and Texas are going to think, well, I can't sign up for this because my state rejected Obamacare. Well, no, that's not true. You can still sign up, it's just going to be harder, right? Because it's a federal exchange and we don't yet know how it's going to work. It's mostly going to be an online system with a technical, a person that they've trained and certified to help people with applications. Sort of like Medicaid now. But who is going to pay for those people? It's unclear because I think when you call your local agency in probably Louisiana and Texas, they're going to say we're not doing that because we don't participate in the Medicaid expansion. So it's up to us to educate our members and the people we work with that yes, we can still do this. And yes, my employer still has to follow the rules. And then Arkansas is a little bit different because they do going to have a state exchange, but it's not quite what the government wanted them to set up. It's like a weird partnership experiment. So we'll see how it works because different pots of money are funding different things, right?
Yes.
And so it's all very complex, but I think the most important point we want to get to our members is that even though our governors are saying, we're not participating, as individuals, we can all sign up for it.
What kind of insurance are state employees under in Arkansas?
What is it, United?